I'm Judith Beck, and today I'm interviewing my father, Dr. Aaron Beck. We are respectively the University Professor Emeritus of Psychiatry, and I'm a Clinical Associate Professor. We're both at the University of Pennsylvania Perelman School of Medicine. And my father is the President Emeritus, and I am the President of the Beck Institute for Cognitive Behavior Therapy in Philadelphia. And we have a number of questions that span your career's work. How did you get into psychiatry?
Well, you know, that's the story of a big flip-flop. When I was in medical school, I was really turned off by psychiatry. The chairman of psychiatry at that time had been a student of Kreplin, and he saw psychiatric patients as falling into one of two categories. Either they were psychotic or they had psychopathic personality disorder. Psychopathic personality is what he called that, and neither were treatable. So that wasn't a very favorable introduction to somebody who wanted to actually help people. And then there was, I believe, one psychoanalyst on the staff who did some teaching, and the way he talked was so esoteric I really could not understand him. So when it came time for me to write an essay as part of my clinical clerkship on psychiatric patients, I really wasn't able to do it, and I had some kind of a mental block. So one of my friends, Marty Gordon, actually helped me to write the paper. So I then went through my internship, and I really could not see much value to psychiatry, at least the way it was presented in those days. But I was very much interested in neurology, and the thing that attracted to me about neurology was, in a sense, it was so scientific. You could locate a very precise area in the brain which could account for a whole multitude of neurological symptoms. And I found that very interesting and very engaging. And so I decided to do my residency in neurology. And I had 2 years of neurology, and it worked out very nicely. And I was planning to have a whole career as a neurologist, maybe do some teaching and some research as well as clinical practice. Then the chief of neuropsychiatry decided that all neurology residents should take a 6 months rotation through psychiatry. And I fought it, but he said, well, you have to do it. And the reason was that they were short of psychiatric residents at the time. So I said, okay. So I did my 6 months, and I felt, geez, I've invested the whole 6 months here, and I really don't have any kind of grip as to what psychiatry is about, or definitely what it has to offer. I remember at times I would be doing group therapy with a group of psychotic patients, and I really had no idea of what to do with them. They would just be sitting around there. Some would be talking continuously, and the others would be zonked out, and so on. But I had several friends there who really were very involved, very passionate about psychiatry. So I went by them, and they said, well, why don't you take another 6 months? So instead of going back to neurology, I spent another 6 months. And at the end of that time, I decided, well, maybe I'll go back to neurology. I just don't dig psychiatry. And one of my friends, good friends, said, you know, your big reason, the reason you can't really understand what's going on is you haven't been analyzed. And I said, well, what does that have to do with it? And said, well, you know, you have these kind of personality problems, and when you're with these psychiatric patients, they stir up all kinds of unconscious conflicts, and that's why psychiatry is so aversive to you, because your id is bubbling all over, and you get into all your defenses, and the defenses prevent you from really understanding what's going on. So I said, well, you know, as long as I've invested 6 months, I'll take a leave of absence from neurology, and I'll try to find out more about psychoanalysis. So I then went to the Austin Riggs Center in Stockbridge, Mass. And I did not get analyzed there, but there was kind of an analytic atmosphere. And it began to dawn on me that psychoanalysis really did have the answer, not only to neuroses, but to all kinds of human problems, war and peace, and even medical problems like cancer could be due to some kind of psychodynamic conflict that people had. So when I came to Philadelphia, I decided to get analyzed, and I went through my whole analysis, and at the end of the analysis, I thought, well, psychoanalysis is really okay, and it really does have an awful lot of answers, but I didn't like the psychoanalytic establishment, and so I thought they were very arbitrary and they were very ritualistic, and it was a little bit like a religion. And in fact, I applied for accreditation by the American Psychoanalytic Society, having already gotten my credentials as an analyst. And I got turned down twice. And the first time was because I hadn't been analyzed long enough. I'd been only analyzed for 2 years, and they didn't like that. And then I had had 4 cases in analysis, but they all got better within a year. And they thought that I really was not really imbued with the whole psychoanalytic ethos, so they turned me down a second time. And so, anyhow, so I still stayed in the field of psychoanalytic therapy for a while, but anyhow, that was my transition from neurology to psychiatry. And they still probably have me the books in Boston as being on a leave of absence.